Orthognathic surgery. Ever heard of it? Do you know what it means? Do you know what it entails? If not, this video is designed to give you further information about orthognathic surgery. Sometimes there's a discrepancy of the upper jaw and the lower jaw, and because of that, the teeth tend to what we call compensate, meaning they move in positions that are not natural for them. And the whole goal of orthognathic surgery is to first have the orthodontist to move the teeth in the right position, and then team up and design a surgical plan with the oral surgeons that will then put the jaws in the right position, and so that you have a nice, stable, and functional bite. And so at the end of treatment, not only will you have teeth that are straight and that are aligned in the position that they should be, but you also have jaws that are matched and there's no discrepancy. First, I'm going to use a simple diagram to illustrate the variety of discrepancies that can exist within the jaws. In order from top to bottom, we have the head, upper jaw, upper teeth, lower teeth, and finally the lower jaw. A disharmony can exist in one or more of these structures in varying degrees of severity. This is an example of the ideal positions of both jaws and the teeth. Someone with good facial harmony may look like this. As you may notice, everything is well balanced. In this depiction, we have a discrepancy between the upper and lower jaws. The lower jaw is small in relation to the upper jaw as it relates to the head. Because it is smaller, it sits further behind the upper jaw. A person with this type of discrepancy may present with this profile. In this illustration, we have the opposite situation in which the lower jaw is large as it relates to the upper jaw and the head. Because it is larger, the lower jaw is positioned in front of the upper jaw. Someone with this type of discrepancy may look like this. This illustration shows disharmony in a combination of structures. Not only is the lower jaw larger, but it is also rotated downward. You may also notice that the structures representing the teeth are not touching. This is called an open bite. So now let's examine the radiographs of an actual patient that has the same bite as the diagram. The upper jaw is positioned backwards, the lower jaw is positioned forward, and is rotated downward. In addition, the upper teeth are sticking out further, as well as the lower teeth. The patient's teeth are not touching in the front, and as you may recall, this is called an open bite. As a result, this patient's lower lip sticks out further than it should be. Here we have the same patient after orthodontic and surgical treatment has been completed. The teeth are no longer flared forward and are properly positioned. Furthermore, the upper and lower jaws are now aligned with one another and the lips are balanced. We have a side-by-side comparison of the before and after radiographs so that you can appreciate the fast improvement and the balanced harmony created by the orthodontic and surgical treatment. Let's take a look at an additional radiograph of the same patient to discuss a surgical technique that has really improved the post-surgical healing period. The surgical technique is the placement of mini plates, which are indicated by the arrows. The mini plates are used to maintain the new position of the jaws after the surgery. This is a huge improvement because it has decreased the need to have the upper and lower jaws wired shut. The mini plates usually don't have to be removed and can't be felt upon touching the skin. Also of note, all of the procedures are done inside the mouth, therefore leaving no scars on the face. Thank you for taking the time out to listen to this video. Hopefully all of your questions were answered and that you have a better understanding of what orthognathic surgery is.